this is Dr. Wells with Wells Medicine, and I wanted to talk a little bit today about integration. So, ketamine integration therapy, KIT, or ketamine assisted therapy, KAP, has been kind of a hot topic and one of the newer things around ketamine treatment. The original studies didn't do any therapy or any integration work. They just added ketamine to whatever was going on in the patient's situation and said, did the ketamine make you better or not? Compared to exactly those same kinds of patients in those same circumstances that did not have ketamine added. And still, with nothing else added, 70 to 80% of patients experience a 50% reduction of symptoms by their second or third infusion. But there is a movement towards adding integration and therapy around the infusions to try to help make that more than 70 to 80%, try to help make it more than 3 to 5 weeks between maintenance infusions, try to help make it more than a 50% reduction of symptoms. And I think that there is some data starting to come out. There's always been anecdotal data and case reports, but I think there's starting to become some data around therapy and integration with ketamine. And certainly there has been some data around therapy and integration with other psychedelics like MDMA and psilocybin. And I think it's really obvious in looking at populations of patients who are recreationally using psilocybin and MDMA and LSD and ayahuasca, that without some amount of holistic integration and thoughtfulness about using the changes that these medications can create, that patients just recreationally using these medications don't necessarily become the happiest people in the room. So I also strongly favor doing therapy with ketamine infusions. I always prescribe my patients This Way Up, which is a cognitive behavioral therapy program. I love it when patients come in with their own therapist or literally bring their therapist to a session or have their therapist on FaceTime or Zoom at the end of a session. Generally, I don't have patients necessarily sit with their therapist during the infusion because often our doses are high enough that patients may or may not be able to process things during the infusion. But within about 24 to 72 hours afterwards is a great time to journal, discuss with a therapist, have an integration session. And I think what is so powerful about integration is when you look at life-changing events, whether it's a near-death experience, NDE, often in the literature, a psilocybin experience, a transformative ketamine experience. When patients are talking about these experiential aspects of the journeying, often what they will say is that things came up for them that they were able to integrate into their life. So they realized they needed a work-life balance, or they realized they really needed to spend more time with their loved ones, or they really needed to solve that relationship issue that they've been having with their XYZ family member. Or they really needed to forgive themselves for this thing in the past. And so that's where therapy can be so helpful, because who among us are born with the knowledge of really how to solve some of the family issues that people have, or how to balance work life, or how to go back and really work on forgiveness. And I think therapists can be humongously beneficial because of their experience in different types of therapy, but also because of their experience in dealing with other patients that have these situations, and just common sense advice and different perspectives. Often if we go to a family member, the family member or the friend will agree with us and say, gosh, that boss is just so and so, you're totally right in this situation. But a therapist can really help call us out and help say, how are we contributing to this problem as well? Or what would be a more skillful way to approach this than what you have been using? And so I think therapy can be really, really beneficial once you've seen what maybe needs to be changed via the ketamine infusions. But I think also sometimes there can be things that come up during ketamine that can be very meaningful to patients. And I think sometimes therapists, just like dream interpretation, it can be very, very abstract. And therapists can help us see the parallels in the things that we're experiencing or viewing. A story that came up for me recently was I was doing a stellate ganglion block on a patient, and actually he was telling me about the ketamine experiences he had had and how they really didn't help him, and it was with another clinic, and he just really didn't see any benefit, and they were just so weird. One of them was, basically a full-on exploration of the movie Coco, which is, an animated film about the Day of the Dead. And, in the process of talking with him before his stellate ganglion block, it turns out that he had spent 3 months waiting for a major, major surgery and wondering the whole time if he was going to die during this operation. And he was writing letters to his friends and family and working on his will and getting his, paperwork and his finances in order, and saying goodbye to people. And, in my mind, I could just see the parallel between this movie, the Coco movie, about celebrating your dead ancestors and, kind of a cult and ritual around people who have passed, and the experiences that he was going through at almost the same time with walking through his own process of almost dying. And so I think sometimes from an outsider's perspective, it's really easy to see parallels and to kind of bring into it, what do you want to learn? What can you change from this? What does this experience show you? But from his perspective, he was just like, that was super weird, meaningless, not helpful. So, I really encouraged him to seek some integration help, and to help with translating that to something that might be meaningful to him. Because with any dream or near-death experience or psychedelic trip, where you're having these really, wild or crazy thoughts, sometimes there are things that you can take from them to create meaning in your life. And then you can expound on that and use it to become almost a mantra or a ritual to continue having those changes and that balance into the future. So I really want to encourage integration, and particularly around ketamine treatments. And I'll be talking more about that in the next couple of videos as well.